Can rheumatoid arthritis be controlled by breathing exercises in conjunction with medication? So again, the specifics will vary here a huge amount. There is a lot of individual difference, both in terms of specific conditions and also in terms of individual differences in how we respond to them, and sometimes other health and other factors which feed into this. So as I was mentioning earlier, particularly with any physical condition, the first thing to do, as you probably have done in this case, given the diagnosis, is go get that medical advice, get the kind of latest opinion on what some of the options are available. And when you're using any breathing exercises or meditative techniques or anything along those lines, I think it's particularly important to make sure that you really do assess what's happening first, because your reason for using breathing exercises, etc., is presumably to minimize pain and discomfort and to increase better management. Those are really good things. However, you want to diagnose what's going on before you do that. In other words, you don't want to be successful in your breathing exercises and minimize symptoms. You actually need to know what the symptoms are so you can diagnose what's happening and then get whatever appropriate supports are available. So very important, that's always the starting point. From there then, it would be good to work with somebody to do some one-to-one work, maybe to put together a specific program around your needs. And you see, usually when you're working with anything physiological like that, the program that you put together, it's not just static. It will shift and adapt based on what's happening, and it'll typically be put together in conjunction with whoever your practitioner is. So going to be real-time interaction there, so you can shift and adapt as is needed. But on a broad level, breathing exercises and meditative techniques, visualization techniques can be very, very useful. And this ties in a little bit to the responding to anxiety that we were talking about earlier, in that a kind of an acknowledgement and a working with any feelings of pain or discomfort can be very, very useful. One of the big problems that often happens when we're experiencing pain or discomfort in the body, and this is sort of across the board, is the risk of feedback loops, or vicious cycles you could call them. And that essentially happens where you acknowledge pain or tension in your body, and then you don't like it, so you kind of tense against it, either emotionally or physically. And what that does then is it leads to more pain or discomfort, which leads sometimes to more tension, and there can be a kind of a chain reaction there. So to what degree it's possible to actually address the issue at a core level, that varies massively depending on the diagnosis, and that's the thing the medical practitioner should recommend and give you some prognosis on. But once that's been done and you've discussed a treatment plan, definitely some good core work can be done to help kind of reduce that feedback loop. So you're getting better at working with the feelings that are there, and obviously it's great to see them go down as low as possible. But the thing is that doesn't need to be great pressure, because sometimes even a little better management can add up massively and make a good big difference over time. And also a big thing in working with this, I find, is that you just don't need to be defined by it as much. It's so easy to focus on the area of our health where there's a difficulty, but how many other areas you are healthy and you're doing well? This is not to ignore the challenge, but it's just to, I suppose, appreciate health generally and hopefully spread it as much as possible, to the areas that could be improved in some shape or form. If you found this valuable, do like, subscribe and share. And what's your experience? Do you have any questions or topic suggestions? You can contribute in the comments, on social media using #bodymindself, or at jfl.com.